Hi everyone! In this module, clinicians in training will learn about certain barriers that people who identify as Black face in healthcare settings, as well as how they can promote greater communication and client-centered services to these individuals based on cultural competency and strategies to reduce bias. After this presentation, clinicians in training will understand how they can learn more about a client's cultural identity, how stereotypes and microaggressions affect the care provider and client relationship, how culture and stigma influence help-seeking behaviors, how people who identify as Black seek help for health needs, communication styles across Black or African American cultures, and strategies to reduce bias during assessment and diagnosis for these individuals. As of 2019, 13.4% of the United States population consisted of people who identify as Black. Specifically looking at Galveston, 16.9% of the city consisted of people who identify as Black in 2019. Culture refers to the beliefs, perspectives, and values of a particular group, which is a foundation for how individuals perceive the world around them. To be a patient-centered healthcare provider, medical professionals should seek to learn about the culture of their patients. Culturally competent healthcare providers will promote communication and more effective services for patients. Ways to understand more about a patient's cultural identity include self-education about cultural norms, consulting literature resources for cultural-specific treatment plans, and cross-cultural competency training. Additionally, healthcare providers should consider the patient's perspective on receiving treatment in a respectful manner. Healthcare professionals can also incorporate culturally related strengths and resources into a client's treatment plan. Common negative stereotypes that are projected onto people who identify as Black are that Blacks or African Americans are unintelligent or lazy. Stereotype threat refers to a disruptive psychological state that people experience when they feel at risk for confirming a negative stereotype associated with their social identity. Research shows that healthcare providers stereotype their patients, and patients sense this bias, which results in dissatisfaction with the care they receive. Stereotype threat contributes to elevated blood pressure, increased anxiety, and many more symptoms. This results in an individual's avoidance of healthcare, failure to communicate with healthcare providers, and non-adherence to treatment plans due to miscommunication, increased anxiety during visits, or mistrust in the healthcare system. Microaggressions are denigrating messages that are communicated towards ethnic or racial minorities that show an individual's implicit bias. Examples of microaggressions towards people who identify as Black include a healthcare provider's avoidance of discussing cultural issues or insensitivity towards an individual's cultural group during treatment sessions. Microaggressions are shown to correlate negatively with treatment satisfaction, therapeutic relationship, and perceived competence of a healthcare professional. Understanding the extent of stereotypes and microaggressions are vital to confronting these issues and ensuring that prejudice, discrimination, and disrespectful treatment are eliminated in healthcare settings. Eliminating these occurrences will serve to reduce a patient's anxiety, promote the value of racial and minority groups, provide clear instructions and treatment, and highlight a patient's strengths and successes. When interacting in cross-cultural contexts, understanding how individuals seek help in context of their culture creates culturally adept healthcare providers. Perception and labeling refers to how individuals in different cultures emphasize certain states of wellness or experiences of symptoms. For example, an individual in one culture may place more emphasis on subtle changes in the body associated with digestion or skin sensitivity, while someone from a different culture may be more aware of emotional or psychological changes. These perceptions give insight into when an individual will seek help. Causal attributions refer to the somatic, psychological, or environmental interpretations that individuals may associate with symptoms or signs of wellness. Generally, individuals will match their help seeking with how they interpret their symptoms to mean. Additionally, individuals may consider the social significance of their condition. The positive or negative social reactions of their community will influence whether or not the individual desires to seek help. Lastly, group-oriented cultures may see illness or wellness as being a reflection on the community as a whole and the resources that are available, while individual-oriented cultures see illness or wellness more as a personal responsibility. Additionally, regarding exchange rules, group-oriented cultures may expect that an individual will seek help from intimate or in-group members of the community first, before referring to outside help, while individual-oriented cultures would expect that an individual first seek help from outside resources, and that they would only ask for assistance when they cannot help themselves. All of these factors play a significant role when examining an individual's help-seeking behavior in context of their culture. Typically, people who identify as Black rely on churches or informal supports in their community and family to seek help for health-related needs. This is due to the fact that oftentimes people who identify as Black can encounter cultural distrust, stereotype threat, or microaggressions in professional healthcare settings. Additionally, people who identify as Black are more likely to receive a misdiagnosis due to stereotyping, assumptions, or cultural incompetence on the clinician's end. For example, research has shown that people who identify as Black with anxiety or mood disorders are more likely to be misdiagnosed with a serious mental illness, such as schizophrenia, and inappropriately institutionalized. Additionally, in Black or African American culture, medical illness can be associated with a lack of faith or weakness, which may cause individuals to not seek professional medical care. Provided on the slide is a video of patient experiences of medical neglect and racial bias. The Black or African American community is ethnically, socioeconomically, and culturally diverse. While the experiences of people who identify as Black vary widely, healthcare providers should understand a few cultural norms that are present within this community. First, Black or African American cultures typically place great emphasis on family and close community, so healthcare providers should consider that family and friends should be consulted during the healthcare process. Faith and religion is often a central component in Black or African American cultures, so understanding a patient's beliefs can improve healthcare communication. Additionally, these cultures often place strong emphasis on respect to elders and authority figures. With respect being an important avenue for effective communication, healthcare providers should speak formally and clear with clients who identify as Black, while encouraging the client to ask questions. Healthcare providers should understand that personal and community relationships are often important to clients who identify as Black, so building rapport can come with seeking to know more about the client. Trust can come from showing dedication to the client's health, while being sincere in the services provided to build rapport. Lastly, empowering clients who identify as Black to take control of their health while working towards a healthy lifestyle is helpful, since many times in Black or African American cultures, there is belief that not much can be done to alter fate. To reduce implicit bias, clinicians in training can engage in meaningful diversity training to increase their cultural competence. Additionally, you can engage in self-reflection on personal biases that you may have, as well as actively countering common stereotypes that are associated with people who identify as Black. To counter implicit bias, one should reflect on their own culture to recognize that they may not be as extensive or dynamically knowledgeable as they perceive themselves to be. This helps us to be mindful of other cultures and able to always seek an individual's perspective instead of relying on our outsider assumptions of other cultures. Additionally, having a stance to diversify experiences and seek leadership opportunities to promote inclusion will counter implicit bias. The self-assessment provided on this slide will give you some insight into your possible implicit biases. To find out more information about the topics that were mentioned in this module, refer to the literature and resources here. Thanks so much for watching, and see you in the next module.